Did you know that nearly 70% of adults don't get enough omega-3 fatty acids, even though they're essential for heart, brain, and overall health? Fish oil, which is rich in omega-3s like EPA and DHA, can help fill that gap. You might have heard that eating fatty fish like salmon or mackerel is good for you, but the benefits of fish oil go way beyond just supporting your heart. From improving mood and memory to helping with joint pain and even weight management, fish oil plays a much bigger role than most people realize. We often underestimate how something as simple as a daily supplement can impact multiple systems in the body. In fact, research shows that regular intake of fish oil can lower the risk of cardiovascular disease by up to 30% and help reduce inflammation markers in the body by over 20%. So what exactly makes fish oil so powerful, and how can it help you feel better, move better, and even age better? Keep watching as we break down 8 key health benefits of fish oil with science-backed explanations that are easy to understand and apply. Number 1, supports heart health. Fish oil provides 2 types of omega-3 fatty acids called EPA and DHA. These fats help keep the walls of blood vessels smooth. When vessel walls stay smooth, blood moves with less resistance. Lower resistance means lower blood pressure. Over time, lower blood pressure eases the work your heart must do to pump blood to the body. High levels of triglycerides in the blood can raise the risk of heart disease. Triglycerides are a kind of fat that circulates in the bloodstream. Studies show that regular intake of omega-3s can lower triglyceride levels by up to 20%. Even a small drop in triglycerides makes a difference. Lower triglycerides help reduce the chance of fatty deposits in the arteries. Fish oil also helps blood flow by making platelets less sticky. Sticky platelets can join together and form tiny clots inside blood vessels. These clots can block blood flow or break loose and travel to other parts of the body, causing issues like stroke. By making platelets less prone to stick, fish oil reduces the risk of dangerous clots. DHA, one of the omega-3s in fish oil, supports the electrical system of the heart. The heart relies on precise electrical signals to beat in a steady rhythm. Irregular heartbeats, called arrhythmias, can sometimes lead to serious events. Research suggests that regular intake of DHA can help maintain a normal heartbeat pattern. Over months, people who take fish oil may see fewer skipped beats or extra beats. In several clinical trials, groups taking fish oil supplements had fewer heart-related events. For example, they had lower rates of sudden cardiac death compared to control groups. They also saw fewer admissions for chest pain or heart failure. These studies lasted from 1 to 5 years. While results vary, most show a clear protective trend when fish oil is added to a heart-healthy routine. To tap into these benefits, experts recommend eating fatty fish, such as salmon, mackerel, sardines, or trout 2 to 3 times weekly. Each serving should be around 4 ounces cooked. If eating fish is not possible, a daily supplement of 1,000 milligrams combined EPA and DHA offers a similar effect. Look for supplements that state the amounts of EPA and DHA per capsule. If you have bleeding disorders or take blood-thinning medications, consult your doctor before starting a fish oil supplement. Besides fish oil, maintaining a healthy diet low in processed foods, exercising regularly, and avoiding smoking will boost your heart health. Combining these habits with fish oil gives your heart the best chance to stay strong. Over years, a steady, moderate daily dose of EPA and DHA supports clear blood vessels, stable blood pressure, and a regular heartbeat. These factors work together to ease the strain on the heart muscle and help keep your cardiovascular system in good shape. Number 2, helps brain function. DHA makes up a large part of the fatty tissue in the brain. It plays a key role in building and maintaining brain cells. With a steady supply of DHA, brain cells can repair their membranes and send signals more effectively. Clear signaling supports memory, focus, and overall thinking skills over time. In older adults, higher blood levels of omega-3s often link to better performance on memory and attention tests. For instance, a group of adults aged 60 to 75 who took fish oil for 6 months scored higher on tasks that measured verbal memory and processing speed. They remembered details more easily and reacted faster on simple tests. These gains are small but build up over months to help with daily mental tasks. Children also benefit from omega-3s. During early childhood and school years, the brain grows quickly. DHA plays a role in forming the connections between brain cells. Many infant formulas now include DHA to support this growth. In school-age children, studies show that diets rich in omega-3s can help with concentration and learning. Some research hints that children with low omega-3 intake may have more trouble staying on task or following instructions. Beyond growth and memory, omega-3s can affect mood. EPA seems to play a larger role here. Some trials report that people who take fish oil supplements feel less tense and more relaxed under stress. Over several weeks, participants often describe a steadier mood and less reactivity to daily pressures. While fish oil is not a substitute for treatment of serious mood disorders, it can add support for mild stress or low mood. A common dose for brain support in adults is about 1,000 milligrams of combined EPA and DHA each day. Higher doses up to 2,000 milligrams may benefit those under significant stress, but such levels should be discussed with a healthcare professional. Young children require lower doses scaled to their body size. Always check product labels and follow guidance for age and condition. For best results, pair fish oil with mental challenges. Reading, puzzles, learning a new skill, or social engagement helps form new connections between brain cells. When you combine active brain work with the raw materials from omega-3s, you give your brain both the tools and the exercise it needs. Over months and years, this approach supports clearer thinking, sharper memory, and a more stable mood. Number 3, eases joint discomfort. Joints depend on a smooth surface and healthy fluid lining to move without pain. Over time, the tissue around joints can become inflamed. This inflammation leads to stiffness and soreness, especially in the morning or after periods of rest. EPA in fish oil offers a mild anti-inflammatory effect. By lowering levels of inflammatory compounds, fish oil helps ease the irritation that makes joints feel tight. In clinical studies, people with mild to moderate joint discomfort who took fish oil reported less morning stiffness and greater comfort during daily tasks. After 3 months of daily intake, many participants said they needed fewer over-the-counter pain medicines. Some studies used a daily dose of 1,500 to 2,000 milligrams of combined EPA and DHA. Improvement often appeared after 6 to 8 weeks and continued with consistent use. The anti-inflammatory action of omega-3s works by reducing production of certain signals called cytokines. These cytokines trigger swelling and pain in joint tissue. Fish oil shifts the balance toward compounds that resolve inflammation rather than cause it. Unlike pain relievers that block pain signals, omega-3s address one root cause by calming inflammation at its source. Natural dietary sources of omega-3s include fatty fish, flaxseed, and walnuts. Fish oil supplements concentrate EPA and DHA in higher amounts than most foods can provide. If you choose a supplement, look for one that lists the exact milligram amounts of EPA and DHA per serving. This clarity helps you hit a consistent daily target. Alongside fish oil, low-impact exercise such as swimming or cycling supports joint health. Gentle movement helps maintain joint flexibility and strengthens the muscles that support your joints. Aim for at least 30 minutes of activity most days of the week. When combined with a balanced diet, regular exercise reduces stress on joint tissue over time. If you have existing joint conditions like arthritis or you take blood thinners, check with a doctor before increasing your omega-3 intake. While fish oil is generally safe, it can interact with certain medications. A healthcare professional can recommend the right dose and monitor any changes in your symptoms. Over months, a steady habit of fish oil plus movement can lead to smoother joint motion and less discomfort. Many people find that daily tasks, like climbing stairs, walking, or opening jars, become easier and less painful. By helping calm inflammation where it starts, fish oil provides long-term support for joint comfort. Number 4, protects eye health. Your retina depends on DHA to keep its light-sensing cells healthy. DHA helps form the cell membranes in the retina, allowing signals from light to reach the brain clearly. As we age, the body may not supply enough DHA naturally. A steady source from diet or supplements helps maintain clear vision and reduces eye strain. Dry eye syndrome affects many adults. This condition occurs when tears evaporate too quickly or lack the right balance of oils. Fish oil helps improve the quality of the oily layer of tears so they stay on the eye surface longer. In clinical trials, participants taking fish oil for 3 months often report less redness, itching, and a lower sense of grit in their eyes. Age-related macular degeneration, AMD, is a leading cause of vision loss in older adults. While multiple factors play a role in AMD, diets rich in omega-3s appear to lower its risk. Large observational studies find that people who eat fatty fish 2 to 3 times weekly are less likely to develop early signs of AMD over 10 years. Supplements of EPA and DHA can provide similar support, especially for those who eat little fish. Children and teens also need omega-3s for eye development. Early deficiency may not cause lasting damage, but adequate intake from infancy onward lays the foundation for eye health through life. Many infant formulas include DHA, and older children can gain benefits from eating fish or taking a child-appropriate supplement. A typical daily dose for eye health is around 1,000 milligrams of combined EPA and DHA for adults. Some studies of dry eye use 2,000 milligrams daily under medical supervision. If you wear contact lenses or spend long hours in front of screens, fish oil can add an extra layer of protection against irritation and fatigue. In addition to fish oil, wearing sunglasses that block ultraviolet rays and using regular breaks from screens helps protect the eye's surface and reduce strain. Blinking exercises such as closing your eyes fully and holding for a few seconds several times each hour also support tear film health. By combining these habits, a regular fish oil supplement, protective eyewear, and mindful screen breaks, you support both the physical structure and function of the eyes. Over time, this approach helps maintain sharper vision, more comfortable eyes, and a lower risk of age-related changes. Number 5, improves skin condition. Omega-3 fats help maintain the structure of the outer layer of skin, called the epidermis. A healthy epidermis holds in moisture and keeps out harmful substances. When your skin can lock in water, it feels softer and more resilient. Dry or brittle skin shows cracks that can let irritants in. Fish oil helps seal those cracks by boosting the skin's natural barrier. Clinical trials show that people who take fish oil supplements often report smoother, less flaky skin after 8 to 12 weeks. Participants with mild eczema notice fewer red patches and less itching. Some studies used a daily intake of 1,500 milligrams of combined EPA and DHA. Improvement typically appears after 1 to 2 months of consistent use. Beyond moisture, fish oil supports the skin's healing process. After minor sun damage or small cuts, skin cells need fats to rebuild cell membranes. Omega-3s supply these fats. In one study, volunteers who took fish oil supplements healed small experimental skin wounds faster than those who did not. The difference showed up as narrower scars and less redness around the wound. Fish oil may also help with acne. Acne involves inflammation in hair follicles and oil glands. By lowering inflammatory signals, omega-3s can reduce swelling around clogged follicles. While fish oil will not clear acne entirely, adding it to a basic skincare routine can help reduce the severity of breakouts over time. Alongside fish oil, a balanced diet rich in fruits, vegetables, and whole grains gives your skin vitamins and minerals it needs. Vitamin C, for instance, supports collagen production. Zinc helps control oil production and repair skin. Drinking plenty of water also helps maintain skin hydration from the inside. For most adults, a daily dose of 1,000 milligrams combined EPA and DHA supports skin health. If you have a specific skin condition, higher doses up to 2,000 milligrams may be used under a doctor's guidance. Always follow the label instructions and discuss any new supplement with a healthcare provider, especially if you have other health conditions. By pairing fish oil with gentle daily skincare, such as using a mild fragrance-free cleanser and a basic moisturizer, you support your skin from the inside out. Over weeks and months, you may notice fewer dry patches, quicker healing of minor damage, and a more even skin tone. With steady daily care, your skin can stay soft, strong, and resilient. Number 6, supports immune function. Fish oil helps balance the activity of the cells that fight infection. EPA and DHA influence white blood cells, guiding them to respond to threats in a measured way. When you have a mild infection or a small cut, a balanced response helps clear the problem without excessive swelling or tissue damage. In several studies, people who took fish oil supplements showed changes in markers of immune activity. For example, after 8 weeks of daily omega-3 intake, researchers noted lower levels of certain inflammatory proteins in the blood. These proteins, when too high, can cause the immune system to react too strongly and create ongoing low-grade inflammation. A balanced immune response also means fewer flare-ups if you have an autoimmune condition, such as rheumatoid arthritis or lupus. In these cases, the body attacks its own tissue by mistake. Omega-3s can help tone down overactive immune cells, easing joint pain or skin redness without shutting down the immune system entirely. Children and older adults often have weaker immune defenses. For children, DHA supports development of immune tissues, such as the thymus gland. In older adults, daily omega-3 intake can help maintain normal function of immune cells that tend to decline with age. Many trials report fewer days of common cold symptoms among those who take fish oil routinely. A typical dose for immune support ranges from 1,000 to 2,000 milligrams of combined EPA and DHA per day. If you have specific concerns, such as frequent infections or an autoimmune diagnosis, discuss a tailored dose with your healthcare provider. Fish oil is generally safe, but it can interact with certain medications, including blood thinners. By adding fish oil to a diet rich in fruits, vegetables, and whole grains, you give your immune system both the fuel it needs and the checks and balances to work smoothly. Over time, this approach supports a steady, controlled response to threats and may help you stay healthier throughout the year. Number 7, may aid weight management. Omega-3s in fish oil can influence how your body burns and stores fat. EPA and DHA help regulate hormones that control appetite and metabolism. With regular intake, people may feel satisfied with smaller portions and find it easier to maintain a healthy weight. In controlled trials, participants who combined fish oil supplements with a calorie-controlled diet lost more weight than those on the same diet alone. Over 12 weeks, the group taking omega-3s saw an average additional loss of 1 to 2 pounds. The extra loss came from fat rather than muscle, suggesting a shift in how the body uses stored energy. Fish oil also supports muscle function. When you exercise, muscles need fats to repair and grow. By aiding muscle recovery, omega-3s help you stay active with less post-workout soreness. More consistent activity burns more calories over time, reinforcing weight management efforts. Studies in overweight adults find that fish oil can improve levels of leptin and adiponectin, hormones that tell your brain when you're full and regulate how the body breaks down fat. Better hormone balance means fewer cravings and steadier blood sugar levels, lowering the chance of snacking between meals. A daily dose of 1,000 milligrams of combined EPA and DHA is common in weight-focused studies. Taking supplements alongside regular exercise and balanced meals yields the best effect. High-intensity interval training, strength work, and brisk walking all complement the metabolic support from fish oil. Before starting any supplement for weight control, check with a healthcare provider, especially if you take medicines for blood sugar or cholesterol. When used correctly, fish oil adds another tool in your toolkit for sustainable weight management and overall health. Number 8. Supports bone health. Bones rely on a balance of building and breakdown processes to stay strong. Fish oil's omega-3s help tip the scale toward formation of new bone rather than loss of old bone. EPA and DHA influence cells called osteoblasts, which build bone, and osteoclasts, which break it down. In clinical trials, postmenopausal women who took fish oil supplements for 6 months showed higher markers of bone formation and lower markers of bone loss compared to a control group. Over the long term, this balance can translate into slower decline in bone density and lower risk of fractures. Omega-3s also improve absorption of calcium, the main mineral in bone. With better calcium uptake, the body can use the mineral to strengthen bone structure instead of excreting it. Some studies pair fish oil with vitamin D and find an even greater boost in bone density, since vitamin D is also key for calcium absorption. Besides postmenopausal women, older men benefit as well. Age-related hormone changes affect bone maintenance in both sexes. Regular intake of around 1,000 milligrams of combined EPA and DHA supports ongoing bone remodeling, helping bones remain dense and less prone to breaks. Exercise is critical too. Weight-bearing activities such as walking, jogging, and light resistance work stress bones just enough to prompt new growth. When you combine these activities with the nutritional support from fish oil, you set the stage for stronger bones. If you have osteoporosis or other bone concerns, a healthcare provider may suggest higher doses of omega-3s or pairing fish oil with a calcium-magnesium supplement. Always follow professional guidance. Over time, adding fish oil to a balanced diet and regular exercise routine helps keep your bones sturdy and your risk of fractures lower. Thanks for watching, and if you found this helpful, don't forget to like, subscribe, and share it with someone who might benefit too. Stay healthy, and we'll see you in the next one.